Good evening. Thank you all for attending our Homeless Services Community Forum this evening featuring Be Well OC. My name is Natalie Basmaja and I'm your homeless coordinator for the City of Newport Beach. We have the second presentation in our series tonight. The first one was in September. That one featured our CityNet social services contractors discussing the housing process and also their success stories. Next month, we are featuring Share Ourselves. They're based in Costa Mesa. They have been an integral partner for what we do to help people experiencing homelessness or those that have certain needs in our community. All of these programs are being recorded by NBTV. If you have friends or family that could not attend tonight, please let them know that they can view this program and the other programs within 48 hours of this occurring. We contract with Be Well OC to provide mental and behavioral help and also for help with people using substances when they're in crisis. The team is deployed out of the Newport Beach Police Department when they're not responding to calls for service for somebody in crisis. We have tasked them with proactively engaging with our people experiencing homelessness out in the community. We're doing it a little bit differently than some of the other cities, but we are seeing better results in terms of people connecting to services, Be Well collaborating with CityNet and with Share Ourselves. They can do intakes at our Costa Mesa Bridge Shelter. So they've become a big piece of how we are addressing homelessness, mental health, behavioral health, and other issues in our community. The team deploys 7 days a week from 7 a.m. to 7 p.m. They drive a big blue van, which may come by later this evening, so you can all see it, and pictures of the van will be in the presentation as well. The van was donated by a Newport Beach resident to the cost of $132,000. That also included funding for the van to be retrofit with their specialized equipment. It has a bicycle and a wheelchair ramp in the back, and it also helped pay for the logos and the branding on the van. So it's a Newport Beach van for Be Well, and you'll see the Newport Beach logos on the van. This evening, we have Alyssa Guerrero from our Newport Beach team. She is the supervisor of our Newport Beach mobile response unit. And we also have Vine Peace here, and he is the supervisor of the care navigation team for Be Well. After their presentation, we will have time for Q&A if anything wasn't covered, or if you have specific questions about how the county and Be Well specifically deliver mental health and wellness services. So with that, I'll turn it over to Alyssa to present the first part. Thank you.
All right. Hi, everyone. Good evening. Thank you for being here. So, like Natalie said, my name is Alyssa Guerrero. I am the supervisor for the Newport Beach Hope Team, or Be Well OC team. In other cities, we're known as the Hope Team. Here in Newport, we're known as the Be Well team. So sometimes I interchange the words. So I'm just to kind of give you a breakdown of what it looks like. I'm going to go over Be Well, who we are, what we do, how we started. I will give it over to Vine after, who will talk about our Orange campus, where people are able to receive services, and he could go into more detail about that. And then I'll come back to me, where I will speak specifically about the Newport Beach team and our van in the city, and some success stories that we've had since we've been running since, I want to say, February 21st or somewhere around there. All right, so Be Well OC, we bring together the public and private sectors, hospitals, academics, faith-based community organizations to build a transformational system of mental health care for all Orange County residents. So Be Well has recognized that there's kind of a problem out there with all the systems and agencies going on. It's kind of fragmented. And the goal, well, we'll get to the goal, but the fragmented silos that are currently happening and have been happening results in an increase in crisis, right? A lot of times law enforcement and EMS are the default response to handle crisis situations, which can include mental health, substance use, homelessness, and a lot of other situations. The default destinations for those places are emergency rooms, hospitals, and you can only imagine what it would look like for a 13-year-old child who is having a mental health crisis, panic attack, anxiety, depression, maybe, having difficulty going to school, being taken to an emergency room where people are in pain, where people are suffering. It could be a pretty traumatic experience for them, where there's just white walls, loud noises, beeping everywhere. So Be Well has recognized that there's kind of, a crisis with all of the agencies and the systems that are currently in place. Sometimes you can receive services if you're insured. Maybe you might have better resources if you're uninsured and have, Medi-Cal per se. But you don't always know where to go. You don't know where to start. You don't know who to talk to or how to get a referral or how to get connected. So with that, Be Well is trying to come up with a solution of having this more unified system. You'll see that's our emblem of having everything kind of all come together, put together. So being able to help those who are insured, uninsured, being able to take them to a more private place where it's not just an emergency room, where fire and police officers don't just have to respond, where sometimes situations get escalated because of their uniform, because of having weapons on them, where we are more of those individuals who can approach situations and help people and just kind of come in non-judgmental, take time with them, de-escalate the situation, and really help figure out and navigate them through the system. This is where we'll discuss the campuses. I will introduce Vine to you. So we have an orange campus, which a lot of people don't know that. Some people do, and they're not always sure what is at the orange campus. As you can see, we will have an Irvine campus coming at some point, and then a later campus down the road. So I will go ahead and pass it to Vine.
Thank you. Hello, everyone. Again, my name is Vine Peace. I'm a care navigation supervisor here at the Be Well campus. I'm actually at the orange campus. In fact, that's the only campus we have open right now. We are set to open an Irvine campus. Right now, the orange campus is located right on the 22 and the 57, right where the 22 and the 57 meet. We're right, and we did that on purpose. We want everyone to see us right there. We want to be right in the middle of Orange County so everyone can see what we are and what we do there. The Irvine campus, and that's on a 2-acre, and I think it was a $20 million expense on that. And the new is a 22-acre, $40 million expense. Then we're going to have one, the central, it was somewhere in Huntington Beach, somewhere in that location right there. So we can pretty much be all over Orange County. Like Alyssa was saying, this is what it looks like right here. One of Be Well's goals is to provide private care to Medi-Cal recipients. A lot of times in this, when we said we want to transform healthcare, mental health care, and substance abuse treatment in Orange County, what we're saying is that we want to change the culture. By changing the culture, we want to change the experience. Before, like she was saying, $100 million a year goes to sending people to the hospital and to jails every year. What she was saying before is that the average stay in a hospital for an emergency stay, $2,000, $50,000, 50 patients a year are sent to emergency rooms for behavioral health or mental health issues or substance issues. And what happens when they go to those places, when they go to jails or to a hospital, that's the absolute wrong place. If you're having a behavioral health or a substance use issue, what's going to happen is the hospitals are compacted, they're super busy, and even though they're going to help them, is better places to receive help for behavioral health and substance use. And so what happens when you see the Hope vans out in the city, what's going to happen more than likely, they might come to this building right here. And once they're here, I'm going to show you what happens when they get here. And so this building, everything about this building promotes health. The way it looks from the inside, from all the furniture, the color scheme, everything, it promotes health, and that's done by design. So it's another kind of thing. Okay, so the very first thing you see when you come into our building, you see this garage right here is where the Hope vans enter. We deal with, let me back up a little bit. again, I'm the care navigation supervisor at the Orange campus. My job is to collect, vet, and manage resources. One of the main resources that I manage is the Be Well building. Inside of our building, we have two emergency services. Our main emergency service is the CSU, the Crisis Stabilization Unit, where if someone is having a behavioral health or mental health issue, they'll come to our Crisis Stabilization Unit. On here on our first floor, there's 15 beds. And so if you don't get into our crisis stabilization unit, say if you were having a substance use issue, they pick you up on the streets, the police pick you up on the streets, and you're under the influence. Going through the loop, going to jail is the absolute wrong place to do it. Creates another expense on the city and on that individual and doesn't create any help. But once you come into our sobering center, where is it? Right here. Right here in the front, we have a sobering center where it's the one and only sobering center here in Orange County where someone can come under the influence and stay up to 24 hours. And what's going to happen, they're going to meet the care navigation team. The care navigation team is going to ask them, do you want service? Do you want to change your life today? Do you want to start that track? You want to get that track started in the treatment. When we are running at combat speed, I was in the Army, so I use a lot of military terms. When we're up and running at combat speed, we have a withdrawal mat, we have a detox on our campus, has 12 beds. We have two residential drug treatment programs on our campus, a 3.5, which is a co-occurring program, and a substance use only program. Inside of our building too, we also have Jamboree housing. We used to have county in our building. We have NAMI inside of our building. So when people call, the care navigation takes about 90% of the calls that come into the Be Well campus. And so we deal with people in crisis on a daily basis. So we judge and see if we assess the cause, if they're in crisis or if they just have a general information question, an inquiry. And so I encourage, if you have any questions about behavioral or mental health or addiction, just call the Be Well campus. I will give them a card out at the end of this. Call the Be Well campus and talk to a care navigator, and we can get you to the right place. That's part of what we do. All right. This is what the crisis stabilization looks like. Crisis stabilization unit looks like. Once someone gets into the Be Well building and they are assessed to be in a crisis, instead of going to, I don't know if you understand what behavioral health or mental health looks like, but this is far from what it used to be. Everyone has individual chairs, so it's not, and everyone is treated with dignity, respect, and customer service. That's the Be Well way. All right, let's get past this a little bit. This is our sobering center. This is sobering center, so if you come in under the influence, all the beds are low to the ground for fall risk. And so, like I said, in the sobering center, it's the one and only in Orange County. So if you're under the influence, instead of going to jail and going through the system, you can come here, hopefully get some help. We can put you in our detox. I have a really quick story of how it all works at combat speed. So we had a fella, his mother brought him into our sobering center. He was under influence. He was drinking 90% rubbing alcohol. Yeah, he had a real problem. He was drinking 90% rubbing alcohol. We put him into our sobering center. From there, we put him in our withdrawal management. We kept him there 14 days. From our 14 days, from there, we connected him with the art team, which I don't want to go into that. We connected him with the art team, which got him into our residential program. He stayed there for 90 days. From 90 days, we connected him with the sober living. He stayed in the sober living for 6 months. He started volunteering on the Be Well campus as our ambassador of hope. So we have ambassador of hope. We have ambassadors of hope as volunteers. He did that for 6 months. Now he's an employee at Be Well, right? And then he's on a care navigation team right now today. And that's just how we always say our motto is hope happens here, because this is a business of hope. And so when you see it on our vans and we put people out in the community, and that's what it's about. And it all starts here. Just come in here. We always say people get arrested in our community, but we say you got rescued. You didn't get arrested. You were rescued. You came to Be Well. All right. So it's crisis stabilization numbers, but I have a card. I'm going to give you all of those so you can access those. Yeah. All right. The Irvine campus isn't up and running yet, but all right. So that's where Alyssa takes over the Hope team. I don't want to step on her toes, but again, we're going to save some room at the end for a question, Q&A. QCC, questions, comments, and concerns. And so come back, and I have my card for everybody if anybody has any questions for me.
All right. So, Be Well Mobile Response Team. So, a lot of people ask, what are our credentials? Who are we? Who are the people who ride on the van? What do we do? Where do we come from? Right. So, I know I introduced myself as Alyssa Guerrero. I actually have a master's in clinical psychology. I'm an MFT as well. I've been 8 years in the mental health field, started with grief and trauma therapy for children. And then eventually I started working with school districts, provided counseling and therapy services to high school students, kids in crisis, at-risk students within Irvine School District and Garden Grove School District. From there, I started working in private practice, community-based setting as well, providing counseling and therapy services to children, families, individuals, couples, adults, marriages as well. And then I came over to Be Well. So Be Well started originally in August of last year in the city of Huntington Beach. That was our very first van, our very first city, the very first city that we started doing outreach and providing mental health crisis support. From a year ago, we are now in 5 different cities. So Huntington Beach was our first city, then we moved to Garden Grove, then we eventually got Newport Beach, Irvine, and Anaheim. So those are the 5 cities that we're in. Each of the vans, which is kind of a picture of our blue van. Some of you might have seen it out in the community already. I know some of you are very knowledgeable about what Be Well is, or you've seen the van at the police department here in the city. It always has 2 crisis intervention specialists on the van at all times. Each of those individuals have some form of mental health experience. They either have a degree in psychology, they might be master's level. Some of them are in their doctoral programs for psychology. Some of us are licensed, not all, but some. And some have worked with Child Protective Services, have worked in school districts, have done ABA therapy. So a lot of diverse backgrounds and experience. So who is the HOPE team or the Be Well OC team? HOPE technically stands for Helping Out People Everywhere. So the team, we are specifically mobile response. We provide community assessment stabilization with individuals experiencing anything under the umbrella of mental health. Our team works in partnership with all of the local law enforcement. So in each of the 5 cities that I named, we work closely with the police department. Luckily here in Newport, we get to have our office at the police department. So we have a very, very close working relationship with them. Anytime that an officer is out on a call that they feel like would be more of a mental health, the person, didn't break any laws, there's no reason to arrest them, they might be unhoused, or they might be a housed individual who just needs extra support, guidance, and may or may not be using substances, they will call us out and they will just transfer the call over to us, let us handle the situation. Where we're able to spend more time with the individual, we're really able to help de-escalate them and just kind of assess, figure out what's going on, what services they might be connected to, what services they would like to get connected to. So what Be Well is, what our vans are trying to do, is to really be that 4th arm, right? We want to be the 4th arm of the crisis response system. We are in all of the cities deployed by dispatch. We want to be those first responders for mental health specifically. So the only way to get a hold of our Be Well teams is to call 911, and the dispatchers will let us know if there's a call for us. So currently there's the CAT team and PERT team, outreach and engagement, street medicine, and then our Be Well vans. So instead of just having the options of fire, police, EMS, you can now have the 4th option of the HOPE van. So we're based off of, and our program is based off of the Cahoots model, which started in Eugene, Oregon. They've been, I want to say, active for at least the past 30 years, where they work in the city. It's a little more rural over there, but they work to respond to mental health crisis. And that's what we are based off of. We have modified it in a lot of ways to fit the needs of Orange County. So like I said earlier, the team has 2 crisis intervention specialists. Everyone is thoroughly trained from the beginning of the minute that they get hired to, how to work on the van, What kind of techniques do we use? What kind of education? How do we approach someone? How do we talk to someone? All the way to, how do we work with the police in our specific city? How do we work with people like Natalie in each city? How do we work with all the other agencies? Because although we are our own nonprofit, we still want to collaborate. That's the only way that we're going to be able to unify this system, is to be able to collaborate with all the different agencies. Just last week, CityNet, Be Well, Natalie, who's our homeless coordinator, and the HLO for Newport Beach Police Department was able to get, was it 8 individuals, 5 specifically, individuals housed. And that's a big thing. Those were chronic, unhoused individuals in the city of Newport Beach, but it took about 4 different entities to be able to make it happen. So that's just one example of how we really want to collaborate. We really want to work with others, and we want to, because that's the only way we're going to get work done, right? That's the only way we're going to make a difference. That's the team. So how do you access us, right? How do you call the Be Well team out if you need it, if you see that someone may need it, or just how do you refer? So anyone who's experiencing any kind of mental health crisis, which, like I said, it can fall under the umbrella of housed, unhoused, a resident, a business, schools even call us, you would call just 911 or your non-emergency number. The dispatchers will ask a series of questions to make sure that it's safe for our team and for the individuals to arrive on scene. Or like the other option is, if officers are already on scene and they feel like it's more of a mental health situation, then they will call us out and let us know. So dispatchers prioritize the requests that come in, make sure that they're nonviolent, non-criminal, and they will deploy us. So we work, like I said, with the local law enforcement agencies in each of the cities that we're in. All of the calls, are behavioral health, social service oriented. So sometimes people will call us and they just ask for a phone call back. And all it is like, hey, I have a relative who's been suffering, and, what kind of resources are there? Can you provide me with resources so that I can pass it on? And absolutely, we will take down your email. We will go ahead, compile a list of resources, and we'll send them to you so that you can forward them. Sometimes it's like, hey, can we set up a time to meet, because I have a child at home who is in crisis, and they have, declined every other person, but maybe you guys could be the one who actually makes a difference. I just had a phone call, I want to say it was last week, from a father who's concerned about his son, who doesn't want any kind of service. They've tried every option, and I talked the father through, and we were able to set up an appointment to meet him and meet his son to try to help the son hopefully accept service. So one thing about our team is everything that we do, everyone we interact with, is all voluntary. So we will only work with someone who is willing to accept services from us. And the reason for that is just because, we want to make sure that we build that trust and that rapport. Someone's not really going to make a change in their life unless they're ready to. So we will continue to offer services. We will continue to engage. We will continue to build that relationship with them. And they have to be able to trust us to be able to accept that service. So we want to make sure that, that trust is built before, trying to maybe get them into a program, trying to change their ways for, the past 10 years. We had another individual who, chronic alcoholic, since college, and that's all he knew. He only knew his only identity was to drink, to wake up and drink every day. My partner and I went out, I want to say at least 7 times before he finally accepted services. On that 7th time, he went into the sobering center at the Be Well campus. From there, he got cleaned up. He ended up getting to live in a sober living home. To this day, he's been, I want to say, clean since the beginning of this year. He has 2 jobs. He is able to pay for himself. He does not have to live at home with his parents anymore. And he's been clean and sober for 10 months now. But it takes a lot of trust. It takes a lot of trust building. So our goal and benefit is to help our law enforcement partners, help relieve them. And not just law enforcement, but fire as well. The fire departments go on these calls. And the only option that they have really is to take someone to the emergency room. So we are here to help relieve them of this time and those calls. Some of the calls that we go on can take hours. Some of them can be quick, but some of them can take hours. We had an elderly female who was concerned for her safety and was afraid that her husband and son were trying to kill her. And we sat with her for quite a long time to build that trust and rapport with her and to help educate her about all the different options that she had. And we were able to get her to a safe place to not only where she was assessed, but for her age, but also treated for her mental health symptoms that were happening. And so, it doesn't take, for law enforcement who's used to going out on a call and has other calls pending and waiting for them, you couldn't convince that elderly female just to go with them to a safe place within 10 minutes or so. It took I would say like 2 to 3 hours for us to finally get her to trust us enough to take her somewhere. So the added value is that we are trying to reduce the emergency room visits. Obviously, we're collaborating with EMS and fire. We want to be able to have a different way of approaching these individuals, a different process and referral. Priority is, patient safety and our safety as well. So we work alongside other first responders to help figure out how are we going to approach these situations? How are we going to talk to these people? What services have been offered? And what else can our teams do for them? All right, so who can receive our services? Like I said, all of our services are voluntary. A lot of people ask, what's the difference between us and the CAT team? Not everyone knows who the CAT team is, but the CAT team, centralized assessment team, they're the ones who come out and do 5150 assessments to see whether someone is a danger to themselves, danger to others, or gravely disabled. The difference is CAT team is involuntary. So if someone comes out and gets assessed, that's probably because someone's really concerned about their safety or concerned about their well-being. Our team does not do any involuntary stuff. Everything is voluntary, and we will sit and we will talk to them. Not every single situation or encounter results in a transport, although we have that big van and we have the space to transport someone. Only about 15% of our calls result in a transport. The other 85% are de-escalated, handled in whatever space we encounter them in. So like we said, everyone is able to receive services, and the reason why we contract with each of the police departments in the cities is because we want to be available for that city specifically. Our response time, because we are in the city, is less than 12 minutes. I want to say on average about 11 minutes for us to get the phone call, to find out the location, the situation, and for us to respond on scene. Which some other agencies takes a lot longer, or you might be sitting there calling, phone number after phone number after phone number, trying to figure out where does this person go? How can I help my family member? How can I help my loved one receive services? This way you can just call our team and we will figure all of that out. We will talk to you. We will discuss everything with you and, whomever you're concerned about. So we deal with anyone who's in psychosis or mania, anyone who has suicidal ideation, any kind of family disputes. A lot of times when we handle situations with family and children, we have to kind of separate them and talk to them individually and help bridge that communication. So we say family disputes, sometimes it's roommates who are just, they drink too much and now they're having an argument and one wants to kick the other one out and it just gets messy. But when law enforcement arrives, there's no crime, right? Nothing has happened. It's just they need to learn how to maybe communicate, and we are that neutral person and party that can come in and kind of help manage that situation. People on the street, homeless, unhoused, even visitors. one of our very first calls that we got in the city was a female who had been driving aimlessly all night. She started driving at dark, and then somehow she ended up in a neighborhood in Newport. Officers weren't getting very far with her. She was very intimidated because it was like 3 male officers that were on scene. So they called our team out just to see, hey, let's see what this team can do. Luckily, it was all females who responded, and she was a little more willing to talk to us, but she would not exit her car. And she was surprised that it was daylight outside. We sat with her for a really long time, just trying to talk to her. She kept whispering, so it was really hard to understand her. But over time, she got a little more comfortable. And we continue to talk to her, try to get the story straight. What happened? How did she get here? Where did she come from? Does she have friends or family? Luckily, she let us, officers actually look through her phone and were able to find the last people she called and talked to on the phone. And we were able to call family to come get her. Our team did a really great way producing a whole list of resources for the family, and we were concerned about her mental health. So we told the family, hey, we looked up the resources in her city where she lives. These are the phone numbers of who to call. This is the steps that you can take when you get her back home to a safe place, to make sure that she gets thoroughly assessed and checked out. And so we were able to help her get back home. Essentially, I think she was from like somewhere far in LA. We don't even know how she got to Orange County. So welfare checks on individuals. We got called out yesterday to someone on MacArthur who was just passed out on some grassy, patchy area. People get concerned if you see someone passed out because they're intoxicated or they're under the influence of something, or they're coming off of substances. So we went out there, but it was a safe scene. It was fire called us out. So we went out there, just checked up on the person. We're familiar with the individual. So, we do welfare checks. Like Natalie had mentioned earlier, when we're not actively getting calls, our team will do the proactive outreach. We will go out in the community. We will go to the hot spots. We will check in with people. We will find out if they're following up on their process, right? A lot of these people want shelter or want housing of some sort. There's a list of stuff that they have to do and get done before they can successfully get placed somewhere. So we will continue to check in with them, just to make sure that they're following those steps. Shelters, group homes, boarding cares, skilled nursing facilities are some other areas and locations that, we could provide services to. Obviously, intoxicated individuals, whether that's alcohol or substances. So community-informed, culturally and linguistically competent care. Like I said, we're all very, very thoroughly trained. I was just doing an orientation class earlier today of new staff that's coming on for some of the other cities. And that's something that we talk about, just being aware of culture and language. Each of the cities are diverse in their own way. So just knowing and being understanding of that, and how, if we get invited to someone's house, kind of just being aware of the different cultures and how to respect them when we go into their space, or how do we talk to them about mental health, because in some cultures mental health is still a big stigma. So like it says, we have embedded staff who reflect the diversity of the communities we serve, and the model utilizes the internal, cultural, and community resources of the client to resolve their crisis. So that's a picture of the back of the van. Like I said, we transport individuals sometimes, so that's kind of what it looks like in the back. Just a comfortable chair for them to sit. We don't only transport to the Orange campus. That's another question we get often. We will take them to any CSU in the county. We will sometimes help someone get to their medical appointments if that's what is needed. There was an individual who was coming from Huntington to Newport, had a broken leg, was limping up PCH. My team saw him. We said, hey, get in the back of the van. We'll drive you a mile down to get to your appointment. He was unhoused, trying to get his paperwork filled out by his doctor, so that he could get funding, so that he can, try to rent a room or something. So just a couple examples of some stuff that we have done. That's a map of all of our vans in all of the 5 cities that we currently have. You can see where the circle at the top is where our Orange campus currently is. And at the end of 2023, we are hoping to have that Irvine campus open up soon. So those are also all the launch dates of when each of the city came online. And the Be Well OC system. So like I said, trying to unify that system. Navigation is really confusing for a lot of people. So that's where our mobile response team comes in and helps individuals navigate, right, all of the different options and resources that are out there right now. And we are connecting with all of the providers to be able to also have campuses to help these people who are in crisis. And the last picture that's our Newport team. So some of you who are familiar with the team may or may not have seen some of these individuals out in the streets. That's our van at the police department. So that's kind of all of what we do, who we are. Like Natalie said, we run 7 days a week from 7 a.m. to 7 p.m. All of those people are crisis intervention specialists. Should I share more success stories? So like I said, we help serve everyone. We get called out by the middle schools and high schools often. We helped I can't remember her age right now, but I believe she was in middle school. It was either that she had been in trouble often with the school. It was either juvie or mental health care. My team came in, built really great rapport with her, and was able to take her to the campus to receive some mental health care, so that we count and consider as a juvie diversion. That is the goal of our team. That's what we want to do. We want to be able to help divert people from going to jail to, doing that loop in the system, or from going to the emergency rooms where they go in, they get discharged, they relapse, go back into the emergency room, get discharged, and just continue that cycle. Another individual according to him, walked here from Las Vegas, was wearing shoes 2 sizes too small. We found him on PCH. And he said the goal of coming here was hoping that he would either get shot by officers or get in a really bad fight and someone kill him. So obviously there was suicidal ideation there. He didn't have any hope or plan to live. He was young too. I want to say he was around 30. So my team talked to him, gave him all of these different options and resources. We were able to get him to a CSU, and where he was able to get the mental health care that he needed, he desperately needed, and he wanted. He just had no one who had ever stopped to talk to him, to just check in with him to see what he needed. And through the process of taking him and getting him integrated to the CSU, he ended up sharing with us that growing up, he actually lived next to a sober living home, and he had seen so many people go into that home and make it out still sober, with a job, with their own apartment. And he had always thought that one day that could be him, but he had never had anybody stop to ask him if that's what he wanted, or that's what he needed, or how to even get connected. So yeah, a couple of our stories. Back to Natalie.
Well, thank you, Alyssa and Vine. We have time for question and answers if anyone has questions for our Be Well team.
What would happen if you were working with one of those people that took several hours and you got another crisis call? Do you have, can you call on a team from another city?
Yeah, that's a good question. We do not call in a team from another city. Officers, luckily in this city, are amazing. They really take the time to sit with someone and talk with them through their crisis. They are very experienced in this city, luckily and thankfully. But they will stay with that person until we are free, until our team is free to respond. So the officers, we kind of tag team it, per se. So yeah, it's been a good experience.
I have a couple of questions. First of all, thank you for all the great work you're doing, and thank you, Natalie, for putting these on. Very helpful. Just to kind of piggyback on the previous question, what if you're kind of at the end of your 7 o'clock shift, and like you said, most of these interactions take long, and maybe you're starting at 6:30 and expect that it's going to go beyond that?
What happens next?
Yeah.
Yeah, our team stays on the call. We've gotten calls at 6:55 when our team gets off at 7 p.m. and we will respond. And we will go out there and we will take all the time that we need to make sure that the person gets the help that they need. So it's happened, and we do not stop service until 7 p.m. And hopefully down the road in the future we can expand those hours. But officers definitely use us as much as they can.
Do you find that the off hours, the 7 p.m. to 7 a.m., that there are less needs for these services, or it's just a matter of what the city is contracted for?
Yeah, it depends on the city. So in this city, we are 7 to 7. In the other cities, the times are different. It depends on the city's needs and what the police department feels like is their prime time for calls. But here, if there's any kind of situations that arise after 7 p.m., the officers have access to a voicemail line for us where they're able to forward any kind of situations for us to follow up on the next day. So they still make sure that the person, gets some sort of response and follow through.
And are you seeing anything different in our city versus the other cities that you're contracted with?
Good question. I would say yes. In this city, we collaborate a lot. We work very closely with Natalie. We work very closely with the HLO, with CityNet, and with Healthcare Agency. We actually all come together to discuss clients and see, who can get them and meet their needs the best. But we kind of formulate a plan all together, and we make sure that each person is tasked with something so that we can see those outcomes. So I would say, like I said, last week about 5 individuals were housed, and that's because we all came together, collaborated together, and worked all together to make sure that happened.
Thank you. Just one more question.
Uh-huh.
Are all of those beds that you first talked about in the facility, do we as part of our contract have access to all of those beds, or are they reserved for other contracted partners in other cities?
Yeah, well, everyone in Orange County has access to those beds. It's just a problem. We can open up 10 campuses, we'll need 10 more. We're in such, like I said, this is a war. We need so many beds, it's ridiculous. So we have 94 beds there. Everyone in Orange County does have access to them, but to get to them, there's a process. And a lot of times, we, as care navigators, we explain the process to people. We take 90% of the calls that come into our campus, and most of those calls are from loved ones. They're not even the people that need the services or want the services, so to speak. But they're the people so we support the support system of the people. So we come with explanations and information, and so we just teach them how to get into those beds too. So, yeah.
Can I piggyback on
Yeah,
that?
most definitely.
So one of the great things about having this care and navigation team at the campus, like I said, that 13-year-old who was juvie diverted, we took her there. And mom had tons of questions. And we were able to hand off mom to Vine and his team to where they're able to walk mom through the process and let her know what to expect. Because when someone gets taken to the CSU they're there for about 23 hours.
23 hours, we can stabilize within 23 hours. If not, we can keep them 48 hours. If we need to stabilize a little longer, this is a crisis residential unit. They can stay up to 90 days there if need be, if there's spaces.
Yeah, so mom's able to call Vine and his team at the campus and just say, hey, can we check in with my daughter? Can we see how it's going? And him and his team are able to follow up with mom and just kind of walk her through so that she knows what to expect. Because it could be a scary process for someone, especially with your minor away from home for the night for 23 hours.
And in fact, we want everyone to give us a call at Care Navigation. Even if you can't get in touch with any of the Hope vans, give us a call. Give Care Navigation a call, because we can answer your questions. A lot of times, people are so frustrated just because even if you know the resource, you don't know how to get in and access these resources. You might not know. Orange County has so many resources It's ridiculous. From transportation to housing to clothing, to school and education, people just don't know how to access them. And so that's what Care Navigation is. We teach you what resources are available and how to access those resources. So for any reason whatsoever, just general questions, give Care Navigation a call, and we'll get you where you need to be. We'll make the right referrals, get you some help.
She answered it.
Are there any other questions for our team?
As I remember, you are structured a little bit differently in Newport Beach from the other cities. You're more closely aligned with the police department. Can you tell me how that's working and how it works in other cities, and if you see how there could be any better situation in one or the other?
Yeah. So in all of the 4 of the 5 cities that we're in, the teams are actually have access to the police radios. They also have access to the police computer, so they're able to see all of the calls that the officers are on, and they're able to see kind of a history when the team gets called out to a home or to an individual, to kind of see information in the other cities. Here in Newport, we have access to that stuff, but our office is in the police department. So we work very closely with them. The way that dispatchers get a hold of us here is just through cell phone, a private number, and it's been working. We have just as much calls as all the other cities who use the police radios. So we still don't know if that's an added benefit or not. It is a little helpful because there is more information that the teams receive in those other cities, but here we've been managing just fine.
All right. One question for Natalie. There you are. Do we keep a cumulative record of how many times we talk to somebody on the street and how many times we offer them services, and if they decline, and is there a running record on people?
Thank you for the question. Yes, we do keep track, and that's where our collaboration is key. Officer Carter that's our homeless liaison officer. She may have 3 contacts with somebody. I show up, I'm a 4th contact, and then Be Well and CityNet. So when we have those collaboration meetings, that's one of the things we're going over. When was the last time you talked to so-and-so? How did the interaction go? Did they finally process their paperwork? I wouldn't say we have like a checklist, 20 checks by Herman, 10 checks by John, but we do have all of our work come together in those meetings. I do want to go back quickly to why we don't have the police and radios and laptops in with the other cities the way they're doing it. Our chiefs and also our lieutenant and our EMS captain did meet with some of the other departments to find out what best practices were, what some of the challenges were in launching the program. And some of the other cities, when they got their Be Well teams in place, Hope Team, I'm sorry, the other cities are Hope Team, was that the teams are great at mental health and de-escalation, but they may not have known what all the radio codes were and the radio traffic coming in and out. So that's where our dispatchers are getting the person who's really upset or the family member, they're distilling it down to where the issue is happening, how to get somebody on scene, and then decoding it for their team. So it's actually something we learned before we deployed to be able to be more efficient and more responsive.
I was just curious, it was not evident from the photos of your campus in Orange. Are the people that you take to the beds there allowed visitors, or are they just there on their own?
So it depends. It depends on what program they're in. So in the Sobering Center, that's a 24-hour stay. The average stay in the Sobering Center is 11 hours. They stay up to 24 hours. So in the Sobering Center, no. In the withdrawal management, 7 to 14 days to detox, more than likely, and no visitors. But in the residential programs, there's visitors on Sundays. They can visit on Sundays. And as you get further in your treatment, in treatment, there's 30, 60, 90 days. Usually they progress in treatment. So when they're at probably about their 60th day, then they'll start getting off campus and start getting them, integrating them back into life. And so they'll start going on family visits and starting to visit their family, but the families can come every Sunday for the most part. And on holidays, there's usually Thanksgiving dinner, Christmas dinner, things like that. But at the end of treatment is usually when they start integrating them back into society. But for the most part, no. Yeah.
Great. Are there any other
They
questions?
can drop
for
off
our team?
care packages and everything like that every time. Yeah.
Great. Well, I thank you all for attending. We have a lot of information on the back table if you'd like to take information for yourself or anyone in your world. And again, we have in November, Share Ourselves coming to discuss their resources. They have a health and medical clinic, a food bank. They actually serve as a postal service. So going back to what we were saying about getting people getting their documents, if you don't have a mailing address, you can't receive your new driver's license or ID. So Share Ourselves actually functions in that capacity for us as well. So we have somewhere to get somebody a postal address. So I won't tell you everything they do, but that is coming up in November. So I thank you all. And again, this is being recorded by NBTV. Have a great night.